Well, WJER has the Dr. Colonel, Dr. Thomas Rogers in the studio with us for another edition of Medical Minutes. Welcome back, Dr. Rogers.
Skelly, welcome. I'm glad to be here.
Great to
Thanks
have
for
you
having
here.
me.
I enjoyed listening when Laurel and you were talking with Dr. Casey Perkowski. Medical Minutes, so many things to talk about. Today we have quite a few things to cover. First, we salute our pharmacy, the staff. You have a very important day coming up soon.
We do. So it is National Pharmacy Week, and our pharmacy is just amazing people. Because, pharmacists not only, it's just not about dispensing medications. It's about quality and safety too. It keeps our patients safe. It keeps all of our docs safe as well because they make sure they check so many things. Even with this IV fluid shortage we have, they're so involved with things. So just recognizing our team, and Kathy Wiggs, who's our director, just does an amazing job. But it is National Drug Take Back Week this Saturday. That is sponsored by the Tuscarawas County Sheriff. So I know Sheriff Campbell is involved, and DEA gets involved. So, but our hospital is participating in it. So is Trinity. But you can, if you have drugs to bring back, you can drive right up to the south entrance. You don't even have to get out of your vehicle, and we'll have it all day. And it's from 10 to 2 on Saturday, the 26th.
Fantastic. Dr. Rogers, quickly explain why it is so important to dispose of those unused drugs. Are we talking over the counter as well?
Absolutely.
In a proper way?
Yes, really anything. And the biggest reason is you don't want to have medicines at your house that are, one, expired or that you don't need anymore because others can get access to them, especially even kids can get access to them. And you don't want to get confused about medications you're on. So when you have a prescription that you no longer need and you have medications and you don't want to dump them down the toilet, you really want to make sure that we dispose of them properly. And so it's so important and such a safe thing to make sure that you don't have extra medicines at your house.
Okay, and again, we've heard about the COVID virus being detected in sewer water, so you can imagine with the drugs that are being, you don't want to flush them down. There's a proper situation, the protocol is in place. So again, this Saturday, what are the hours?
Saturday from 10 to 2.
Okay, and again, you'll see the activity from the boulevard in Dover. Very nice to have that drive-through situation.
It is.
All right, Dr. Rogers, we love our pharmacy staff. We love the drug take-back day set up for us. And now we have to lead into, well, a couple of other things. Halloween safety and your emergency room department. Describe that relationship.
Yes, so, well, one, it was Respiratory Care Week and it was also our Medical Assistant Week. So again, shout outs to all those folks as well. Just, they do amazing work, so we just want to shout out to them too. But our ED has been amazing lately. Just to give you I know everybody uses it kind of as their gateway to our hospital. It's the gateway to our community too. But there have been some great things recently. Our left without being seen rate has decreased in the last year by 54%. Our scores for nurse and doc communication improved tremendously, up from like the 20th percentile, 11th percentile, up to the 63rd and 75th. They're really concentrating on taking care of our patients. And our length of stay has decreased by 41%. So if you come to our emergency room, our goal is to get you in and treat you. And if you need to stay longer, obviously, if you're really sick, we really want to keep you there. But if we can get you out, we're going to try to do our best. Our team has really done a great job with some surge plans. So those are great. But for Halloween, of course, we don't want you to come to the ED if we don't have to. So part of the stuff today is talking about Halloween safety. But we do love our ED, and I know that they've been doing a great job.
Yeah, to get that kind of triage thinking and a cooperative effort with your entire department. I'm catching you off guard. About approximately how many people, how many staff members in your emergency room department?
Oh, goodness. I think we probably have at least about 100 or so. It just depends on different shifts that we work. I mean, because we've got 24/7 coverage and all the nurses that we have. Sometimes we even have to have some agency nurses that cover at night. We've got probably about 10 docs that are full-time, and then we also need locums docs in order to be able to cover all those shifts. So total, I think, with all of our support personnel, we probably about 100, I would think.
Amazing statistics, really making those numbers head in the right direction. If you do need the emergency room at Cleveland Clinic Union Hospital, we are on the air with Dr. Tom Rogers with Medical Minutes today as we lead up to Halloween. The trick-or-treaters beginning to be the ghouls and goblins hopping around town. A sign of fall is, again, all the pumpkin spice items available everywhere. Trick-or-treaters in Dover, Ohio, where we are this Saturday from 5 till 7. Make safety the top priority. Dr. Rogers, again, it's a nice, great new ER system, but you don't want to end up there from a Halloween mishap or oops. What should parents of younger children keep in mind?
Absolutely. So really the biggest thing is make sure they're accompanied. We always make sure that kids, especially the little kids, don't ever go out by themselves. It's cool that we're at between 5 and 7, I think, on Saturday is our time for Saturday.
Right.
So it's not going to get too dark, but they always make sure they have a flashlight or something to go along. We also don't recommend that they wear a mask if you can avoid it. Maybe use face paint instead, because that mask also can really get to the point where it can hide their vision and not be able to see vehicles. The biggest risk we have is pedestrian accidents. That's the thing we want to avoid. So that every year we have kids that can dart in and out. So if we are out driving at any of those times during the trick-or-treat hours, and anything even during that day, because people can still get around, we really need to be careful about the kids out in the roads, and then the parents need to be careful too. Don't let the kids dart out, especially in some neighborhoods. People will drive to neighborhoods and leave their vehicles, and they're just things that we're not used to. So that's probably the biggest thing. So the earlier the better. If they can go out earlier, it's fine. Crossing the street, make sure they're looking both ways. But when they get home with their candy, everybody's all excited about having their candy. They really need to make sure they check the candy too. We don't recommend that they eat any of the homemade candies. I mean, it's kind of cool. Maybe if you know somebody, that would be the best. But they should just check. It's not that we're worried that there could be anything in it, but they're just anything that's opened or anything that looks like it's been tampered with, we recommend you don't eat those at all.
Yeah, and I'm even thinking homemade may have an allergen in them.
Absolutely, Kelly, because you don't know really what's in it, and it'd be better to have something that has a label that you know for sure, especially those with
peanuts, gluten. I mean, it's homemade, heartfelt, but best to avoid those allergy situations
Absolutely.
as well. Well, again, the homemade treats, thank you for that, but as you said, Dr. Rogers, better within your own circles. Okay, that's for the younger children. Now about some tips for parents of older children.
Yeah, I remember when I was a kid and my older brothers were, we lived on post, and so they could go over and they just take off, right, and they'd be gone. Now, it was very safe on post when you lived in the Army. But you really need to make sure kids know where they're going and make sure that you have a good idea. Because if they are out by themselves, they don't have to necessarily be accompanied, but you should know. Now, of course, we have those Life 360s, and sometimes you can track where your kids are at all times. But you really should at least give a route, because kids, as they get a little bit older, still could be enticed by somebody, or somebody could, potentially have a chance to, take kids, which we don't want either. So they do have to be careful, and it is nice to know where they're at. Again, stay on the sidewalks, make sure they're walking and not running around, because sometimes the kids get older, they want to hit every house if they can, and they're going to fill up probably like their pillowcase bag or something. So all those things. Don't text when they're walking, all those simple things, but same thing, when you've got masks on or other things, you want to be safe and make sure that they're also not walking out in the middle of the street.
Oh, and Dr. Rogers, even the texting while you're walking, if you're on your phone, even in the daytime,
yes,
you can see how an accident could quickly happen. So that's another separate issue beyond Halloween safety. Just a few more moments here for today's Medical Minutes with Dr. Rogers from Cleveland Clinic Union Hospital. Halloween safety among our few topics for today. Many adults love to attend Halloween parties. What do you have? What kind of advice for safe celebrating for adults?
Yeah, so our biggest things that we see with our ED, one is anything alcohol related. So obviously we don't want you driving from a party. Saturday is probably the busiest party night, as well as we have the trick-or-treaters. So careful about any drinking and driving. Secondly, that we see is lacerations from pumpkin carvings. Believe it or not, that's something that happens quite a bit. So when you're trying to make all these nice little delicate cuts into your pumpkin, our ED does see lacerations from that. And then the other is fires and fire pits, because we know it gets a little chilly, and sometimes people have their fire pits out as the kids are trick-or-treating. Watch out for those. Now, it's not that we have fireworks and those kind of things that we typically do on July 4th, but still fire injuries can also occur, and that's something we have to be careful about. So, and then lastly, it's the pedestrian accidents. Even though trick-or-treating is only from 5 to 7, we just still need to be really careful about where we're driving. Those are probably the biggest things that we see.
You do not want more in the hospital after Halloween fun.
Right.
So Dr. Rogers, great safety tips for all of us, younger children, older adults. We appreciate your insight. And by the way, when you and your brothers were growing up in the Army, did anyone get into any kind of military costume and they confused you because they thought you were part of them?
I think some of my kids even dressed up in some of my uniforms as they got older. I'm trying to remember what we all dressed up as. I imagine somebody probably did put my dad's uniforms on or something and walked around. So
Okay.
Probably very common that we did.
Well, if you, dear listeners, have never met Dr. Rogers, he is head of Cleveland Clinic Union Hospital in Dover now. We thank you for your service as always.
Thank you.
And again, for radio listeners, my heart goes out to you that you can't see him right now because your tie is awesome. How would you describe it?
I kind of have my Halloween tie. It's got some pumpkins on there and little skulls. It's all good.
Those are the safe pumpkins that you don't have to carve.
That's right, no carving.
And threaten any Dr. Rogers, great advice again today. Thank you so much for joining us on another edition of Medical Minutes. I hope you have a wonderful Halloween.
Thank you, Kelly.